Eric Wenke, AVP of Corporate Development at Baptist Health, South Florida. My topic today was creating green cultural change, building buy-in for sustainability initiatives, specifically during difficult economic times. In summary, we were talking about the importance of starting small. Often organizations try and bite off something larger in terms of green change, and their organizations are not culturally ready for it. They will fail or they will stall when there are a number of initiatives that they can start on, show immediate success, train the organization, and move up an adoption curve. The benefits that we see, we'd like to break them down along three criteria. So environmental, financial, and health. So in all the projects that we've run, we tend to see environmental benefits in terms of a reduced ecological footprint, less waste, less energy, less water, less consumption, things we can conserve. Those will often have financial benefits as well. Not always, some will cost more money, but often through conservation we're able to save. So if we reduce our energy consumption, it will have a financial benefit. That's money that we can then put back into healthcare, which is our primary mission. Finally, there are health benefits. If you look at the Clean Air Acts, the EPA, their definitions, if you look at the waste we've prevented or the energy that we have not consumed by doing these projects, that's less pollution in the air. And they can track how much bronchitis, asthma, etc. that would have prevented, and we translate that into reduced medical costs or reduce work loss days. We like to speak about that healthy people depend on a healthy environment. So it's not enough to bring someone into our facilities, provide a healthcare service, hopefully a cure, make them feel better, and put them back out into their local environment, pollute it, and make them sick again. So we're trying to look at a total systems mentality in terms of not only what are we doing within our facilities, but what are we doing with the whole local community. The conference has been great. It's been just getting started, but it was a good participation in the presentation today. Good questions afterwards. Could see how many other organizations were struggling with the same questions that we might have had just a year or two ago. In fact, on specific projects that we had launched, those were issues that we had to tackle, and we were happy to share our experience, and hopefully we'll help them move through different areas. It's also great to bring so many parties in from around the world. We do have a very strong international division. Patients do fly to Baptist Health from across the world, and meeting with those tourism ministers, doctors, etc., helps to explain to them both what we do from patient care, and in terms of many of them are also interested in our sustainability initiatives. I've had a chance to meet with a couple of parties. Through the online signups. Some parties have reached out, and we've had a couple of sessions already. That had just started, and I was actually one of the first presenters, so I'll probably have more of that tomorrow. We're one of the preeminent healthcare providers in South Florida, about a $2.5 billion a year healthcare organization, about 6 hospitals, little over a dozen outpatient centers. We tend to see around the range of 10,000, almost 12,000 plus international patients a year. It's part of our patient mix. We're every year rated in the top of healthcare systems throughout the country in terms of patient and physician satisfaction scores. Most recently, Fortune just ranked Baptist Health South Florida as the number 32 place out of their top 100 places to work in America. We were the number 2 healthcare system, so it's a great place to be.